president's new tax cuts and budget bill is expected to have a major impact on local hospitals and nursing homes. Hennepin Healthcare in downtown Minneapolis is the area's largest safety net hospital. It estimates it will lose $145 million in funding a year. 95,000 patients, half of their total patients about 200, more than 200,000, depend on Medicaid. 87% of all births at the hospital are paid for by Medicaid, but the hospital will still be required to treat all patients regardless of ability to pay. The predicted result, long lines in the ER, cuts to major specialty programs. Dr. Tyler Winkelman is a doctor at the hospital and associate professor at the University of Minnesota Medical School. Thank you so much for coming in. You told me that actually the impact may be far greater than that. This hospital, which serves 250,000 patients in downtown Minneapolis, may actually have to close because of this?
This is a really challenging situation for our health system. As Commissioner Connolly said, when patients lose health insurance at this scale, we have to figure out some other way to operate, whether that's reducing services, bringing in income in some other way. I'm really worried for my patients who are going to have to try to find some way to navigate these really challenging administrative requirements that were put in place.
And I want to say Hennepin Healthcare may be sort of known as sort of a city hospital, but it is a level 1 trauma center. This is where police officers injured in the line of duty, that's where they're brought because of the excellent trauma care. Also, you have the premier burn unit, poison center, things that serve the entire state of Minnesota. Will you have to cut programs to handle the influx in the emergency room? Because you can't turn people away when they come to the emergency room.
That's right. I think right now we will have some really big decisions to make in the coming years. And as a primary care doctor, if my patients can't come in to see me, they're going to wait until things get really bad. And that means that once things have hit this point, then they'll need to see my colleagues in the emergency department. And we really worry about the emergency department filling up, and that then sort of limiting access when these really important traumatic events happen where we need to respond quickly and have an emergency room full of people.
Right, and that's one of the concerns is that obviously this will go unreimbursed because they won't have insurance. That's the kind of thing that puts pressure on all our medical bills. I mean, do you see this as driving up costs to people who are not on Medicaid?
Yeah, I think that's a very possible scenario, is that health systems who are providing a lot of uncompensated care have to find some other way to cover the costs. You know, when we as providers think about healthcare policy, we want policies that improve care, improve quality, improve access. And this bill only removes people from healthcare. It doesn't really have any policy in it that would help contain costs.
I want to ask you that one of the things that we're hearing in the analysis is that it's going to hurt rural hospitals and nursing homes, perhaps even more than city hospitals. Why is that?
It's a great question. Medicaid covers most nursing home stays in the country, and rural hospitals take care of a disproportionate number of people who are enrolled in Medicaid, and rural hospitals are just getting by right now. And so this big of a hit is going to have both an impact on places like Hennepin Healthcare that take care of a lot of people with lower incomes, and it's really going to have an impact on our colleagues in rural areas and who are working in nursing homes.
We talked before the show, and you said that, like the commissioner, you were concerned about this work requirement, not because of the work requirement, but because of the paperwork that's going to be required to be filled out on a semi-annual basis at least. How big a problem do you see that being with the patients that you see?
This is going to be a huge problem. One of the best analogies I've heard is, have you ever subscribed to a 6-month free trial and forgot to cancel your subscription.
Yes, I have many times.
Yeah, so think about doing that every 6 months.
Or the price goes up.
Yeah, so think about doing that now every 6 months for the rest of your life. And if you kind of mess it up one of those times, you'll lose your health insurance. That's what our patients are going to have to do now. And many of my patients have disabilities, cognitive impairment, other health problems that are going to make this paperwork really challenging.
Okay, well, Dr. Winkelman, thank you so much for coming over, and we really appreciate it this morning.
Thanks for having me.